Hi there. Hey, everyone. I'm Tanya Rivens. Yeah, that's my name. Thanks for watching Canceling COVID on this Wednesday. This is the place where real people have real talk about how we can protect ourselves, our family, and of course, our way of life in the middle of a global pandemic. We share that with you every time because it's so important that you know that we're working together to cancel COVID. Now, our sponsor for today is, of course, the Mecklenburg County Department of Public Health. We're so grateful for them. mecnc.gov or call 980-314-9400. They're available to educate you, to give you information as you navigate through this pandemic. It's not over, folks. We're still working at it, so keep that in mind. In the last week or so, more and more people have begun to leave their mask at home as the government has relaxed the rules. And, you know, this option is making some people uneasy. So, our question of the day: how does this option appeal to you? How does having the option to go unmasked make you feel safe, or how does it make you feel? Jump in the chat and weigh in on the questions. I see you popping on. I certainly would love to hear your feedback. Again, the question of the day: the option to go unmasked. How do you feel about that? Are you a little uneasy? Are you comfortable? You know, we've been talking about this last week. We talked about this to a certain degree, and we talked about travel. But just more and more people now, as you head out, you're not seeing masks and you're in crowds. I was at a basketball tournament this weekend, and some people around me didn't have masks. One lady asked to sit next to me, and I answered before I realized she didn't have her mask on. So I like scooted over, tried to do my physical distancing. But if I had paid attention, I would have said, I'm just a little uncomfortable because you don't have your mask on. And we were inside, and I'm talking a basketball tournament. So a lot of people were in there. But again, I'd love to hear your feedback. How are you handling this? Are you seeing people? Are you afraid if you see someone you're not comfortable with and they don't have their mask on? Do you say something? Because people are so sensitive now. So maybe that was my common sense saying just don't say anything. But right now, a major landmark for the United States, some really good news. According to the CDC, 60% of American adults, they have gotten at least one vaccine, COVID-19 vaccine. And you got to check this out as well. More than 4 million young people between the ages of 12 to 17, they've gotten their first dose as well. And that's really interesting that the young people are like, come on, we got this. We're not concerned to the degree that you guys are. We were ready to live. And maybe they're tired of being blamed too, when they were out partying and doing things and people are like, oh, they're spreading it. Well, they're stepping up now and saying, I'll get vaccinated. So it's good to see those numbers, which leads me to get to talk to someone that I really, really am thrilled to have join us. The debate to vaccinate children is happening in many homes. For some families, it's a clear choice. And for this lady, I love, love, love her. I call her your favorite media personality. She's like your next door neighbor. I'm talking about Ashley Anderson. You know her from WCCB News, but two special people, they just call her mom. We call a lot of endearing terms, that's for sure, because you're always the same, Ashley. You're so lovable, and we appreciate you for that. So thanks for taking the time to join us today.
Well, thank you so much for having me. It's so good to see you. I've missed you. I haven't worked with you in person since pre-COVID, so
I
it's great to see you.
know. Well, it's good to see you too. I miss seeing you. So maybe we'll get to connect again. I see you've been keeping busy. So, Ashley, let's jump in. The big news in your home: both of your children have gotten their Pfizer vaccine.
Yeah.
What is this like for you and for them? Let's talk about that a little bit.
Oh gosh, where to begin? The vaccine for us was, I would say, there they are, Kate and Charlie.
Yeah.
I wouldn't say a finish line, but it was definitely something that we were eagerly anticipating. My kids even wanted to be a part of the study so they could possibly get a vaccine as part of a study
Oh,
earlier. This has been a strange year for many people, but in our family, there's been a lot of anxiety around
yeah.
COVID. Feeling nervous going out in public. I have an autoimmune issue, and
Mhm.
so my kids feel it makes me feel sad that they feel like they have to protect me when that's really my
Oh,
job.
yeah.
And so, really, the vaccine for me was me being able to say, "Look, now I can protect you too. I can help make this available to you." And like you said, it's for some families, it's a clear choice. For us, it was a clear choice. Um, for a host of reasons. We believe in medical science, we believe in the research, we believe in vaccines as a way of keeping our community and our community members who can't get vaccinated safe. Um, But just on a street level day to day, it really, even though my kids know they're not, covered, fully vaccinated for another, month or so,
Right.
um, they felt a huge weight off their shoulders. They felt their anxiety lessen, and I did too as a result.
Well, thank you for sharing that story. But what was the conversation like around this? Was there ever any doubt? Was it just handled just like another vaccination that our kids have to get? As a part of being able to survive in this country.
I would say for my kids, two different, very different kids, two very different conversations.
Hmm.
My daughter is 15, and it was impressive to me that she was sort of taking her healthcare in her own hands. She set up her thing on Atrium. She set it up on Walgreens, on CVS. Her profiles. She knew that she wanted this. She's smart. She understands all the science, and she's been living through a pandemic for a year and a half, like everyone
Right.
has, and so she knows what's going on. So she was absolutely wanted to be first in line. My son, I would say, fell victim a little bit to playground talk at the middle school, and
Uh,
says, comes home and says, I think he just repeats things that other kids say, and he says, "I'm not sure, mom. Like it hasn't been long enough." And I'm like, okay, this is my jam. I'm a news reporter. I love the facts. Let's go back and look at exactly the process that they did to develop this vaccine. Look at all the millions of people that have taken it, and all the lives that have been saved. We know, um, and so I think just giving him some facts, some concrete facts that he could hang on to, and then he was fine.
so for those just hopping on, please, our question of the day is: how are you feeling now that more people are unmasked? To have the lovely and talented Ashley Anderson. She's on with us talking about her two children, and Ashley didn't hesitate to share, that they have gotten vaccinated. But to know you and to know that you love Paris and traveling is also your jam, as you said.
Hmm.
But how did this change up your family's daily life? Here now, once you guys got the vaccination or they got vaccinated, because I know there are some people that still don't agree with it, and then certainly I would think that you didn't get all notes of support around this.
Yeah. Yeah, a couple things. One is, we had the golf tournament in Charlotte,
Hmm.
the first weekend or so of May, and that's really when the masks came off in Charlotte, in
Yeah.
big groups. And even though people were outside, my daughter went to the golf tournament with my husband and walked around at Quail Hollow, and she came home and she said, "Mom, it was awful. There were so many crowds and no one was wearing a mask, and I felt so vulnerable."
Yeah.
And of course, a lot of those adults were probably vaccinated, not thinking anything about it. They're just relieved to be outside and,
Yeah.
rip the mask off. But she felt very exposed.
Mm.
And so once she got the vaccine, she feels like both of my kids feel like they can sort of enter back into their lives, a little bit more without as much trepidation and as much fear. When people express concerns about the vaccine, I can certainly validate that. I can understand hesitancy. However, I like to just come back with the facts that we know, and what we know. Really, vaccines. I'm not a scientist. I'm not a doctor. I am, the child and grandchild of scientists and doctors. And my dad had polio as a child. His
Mm.
sister did not, because she got the vaccine. Um, we have real life experience with pandemics in our family going back, and I just really believe it's such a, important aspect of global health, and and the other thing about the pandemic is I feel like some a shared feeling that many of us had was a feeling of helplessness, right?
Yeah.
So if you're not, a doctor working on COVID patients, or a scientist working in the lab to work on the vaccine, what can we do? Well, we did what we could the first year. We stayed home, we wore our masks, we social distanced, um, tried to follow the rules and the suggestions of the CDC and of the government. Um, Now, what we can do is we can get vaccinated, and that helps protect all the people who can't get vaccinated for whatever reason, whether they're small children, whether they're immune compromised, whether they're going through some sort of treatment that doesn't allow them to get a vaccine right now. So that's what we can do to help.
So when you're dealing with people that say, because we know that everyone's not in agreement, you share personal experiences, but for people who still just say they're not trying to hear it, or a lot of people in my community, there's that whole "I just don't trust."
Right.
What if you were in a conversation? What would you say to just kind of ask them to reconsider?
Well, I have one example, and this is a friend in France who
Hmm.
said, I'm going to wait. I just don't think they've tested the vaccine on enough people. Well, when we were having that conversation, America had already vaccinated like 100 million people. And we
Hmm.
said, okay, so if every single person in France, because their population is less than that, if every person in France has been vaccinated and you are the very last one, would you feel like enough research had been done? And he's like, yeah. And I said, well, that's France has been vaccinated. Like in America,
Yeah,
that number of people have been vaccinated. And one of the things I love about technology is the way that the CDC and the vaccine, I don't know what the agency is called. They, you can sign up to be tracked, and they want to know every single symptom that you've had, so that they know what to expect. They can, just they want the vaccines to be safe. Obviously, they're not trying to, like, pull the wool over our eyes, and
right,
it's not some big scam. These are scientists who've dedicated their lives to doing this kind of thing, and they want it to be safe. So I love to use the stats, and then I would just say, is there someone that you trust, their opinion, and I would say like a medical person, whether
right,
it's a
right,
pharmacist, a doctor, nurse, somebody, not just like your Uncle Joe,
right.
who can give you their perspective on this. That's what I would do. And as a parent, that's what I've done many times over the years. I speak to my pediatrician for my kids, she has 4 children of her own, and I say, what would you do in this situation? Would you do this now? We did that with the HPV vaccine,
Yes, yeah.
because that was new, and that was also controversial for many reasons. Did they test it long enough? Do kids even need it? And I asked that question. I
And the
said,
flu vaccine's another one,
yes, yes,
so as they come along, and if you live long enough, we'll have more that will come along. So,
mhm,
that's some great stuff, and that's a great way of presenting it, so it's not confrontational either. And I
right.
love how you talk about science, and they have been, I mean, there were a lot of missteps, but they have also tried to do a lot of things right, which we can appreciate. So, what would you say has been your biggest challenge as far as your mom, as a mom protecting your family, during this whole pandemic?
That is a good question. I would say protecting their mental health, honestly.
Oh, wow.
Because my kids are old enough to really understand the importance of masking. They do it at school. They wear those masks 8 hours a day at school, and then sometimes 2 hours after school on the ball field, which is
Yeah.
just a
It's
walking
tough.
example of resiliency and
Yeah.
their strength. But it is definitely taken a toll on their mental health, and so we've gotten great support from teachers. For example, my son early in the pandemic just could not deal with the remote learning, and he just said, I need to not be at school today online. I just need to be in my bed. So,
Yeah.
I messaged the school and said, I think he needs a mental health day, and they said, fine, great.
Yeah.
So that's really important to have those conversations. And then also for them to, I've given them sort of some tips on how to handle themselves or extricate themselves, sort of like what you were saying with your when you went to the basketball game, Tanya.
Yeah.
Like,
Yeah.
what happens if you're in a situation where you're not comfortable, whether the person's not wearing a mask or whatever the case may be, and what to say and how to act, and what to do in that situation. That's hard for kids,
Yeah.
especially if it's with an adult,
Mhm.
um, who says, "Oh, you don't have to wear a mask," and I just say, blame it on me. Say, "Oh, my mom
Right.
says I have to, or I'll get in trouble,
Right.
or whatever." So that's what
Yeah.
we do.
That's good, good stuff, good talk. So, Ashley, as we wrap up with you again, thank you for joining us. I'd love to hear your thought on the question of the day, which is, how does having the option of going unmasked make you feel right now? Do you think we're ready for it? What are your thoughts on that?
Oh gosh. I think it's probably the right decision at this point because I feel like if you want a vaccine, you can get one in
Yeah,
America. They are coming out our ears, and we are so lucky and so blessed and so grateful. And now it's time for us to share those with the world, right? So if
right.
you want a vaccine and you believe in vaccines and you believe in protecting others in your community, then you can get one. And I think those people are already the ones that have been wearing masks
Yeah,
anyway. So I kind of feel like this is just, I don't think it's going to make a huge difference. I think some people will still continue to wear masks, and that's fine. I don't know about you, Tanya, but
yeah.
nobody in my house had a cold or the flu this year.
Amen.
So, yeah. So
Same
I'm
here.
thinking
Same here.
maybe seasonal masks will become normalized if you're feeling sick, which I'm here for that.
Yeah.
So,
I've
and we're
already
just,
said that. I've already said in the
yeah,
wintertime, I am not ashamed to have my mask on
me
because no
either.
flus came home or anything like that. So yes.
Nothing. And we're so,
Yes.
another thing, we're so lucky with the weather here in the
Yes.
Carolinas that it's been a real treat to be outside more with friends and to dine outside. And my daughter had a choir concert the other night at school
Yeah.
outside. It was lovely.
Woohoo. Yeah.
So, those are some good things we can take away from it.
Well, good, good stuff. Miss Ashley Anderson, thank you so much for joining us. If there's anything else you would like to share as I let you go, I just want to say thank you again. So, any final thoughts from you?
Just I appreciate you hosting the show, having these conversations. I appreciate you having me, and I'd
Yeah.
invite any of your viewers to message me on Facebook if they have questions. If again, I'm not a doctor, I can only tell you our experiences with vaccinations and with this particular vaccine. No kid, my kids did not have side effects from the first one, by the way, but they were ready to have it. They said,
Yeah.
"Bring it on, whatever it takes." Um, so I'd be happy to answer any questions or just hear you out if you have something to say. So,
Oh, thank you,
yes,
Ashley. That's why she's everybody's favorite. She's like your next door neighbor.
thank
So
you.
good stuff. Thank you so much. Enjoy the rest of your day. All
Thank
right.
you.
Hopefully, I'll talk to you again soon. All right, Miss Ashley Anderson. I work with her in television, and you're talking about a beautiful spirit right there for real. What you see is what you get. You got to appreciate that, especially in this industry. So, thank you again. Great to connect with her. Miss Erica Simonton Beatty. Hey there. Good afternoon. She says she's still uneasy about going outside her comfort zone without a mask since all people are not okay with being vaccinated. And that's a legitimate concern. That's what's happening. Also, the concern of people saying they've been vaccinated when they're not, because I mentioned that we're kind of on an honor system right now, folks, and that doesn't always go over too well. But I see others hopping on. Please hop in and share your thoughts on the chat. Even with vaccines and masks, we have to remember just how dangerous COVID-19 is. We lost a whole lot of people. We can't forget about that. More than 992,000 people have tested positive. Whew, let me say that number again. 992,000 people have tested positive, and nearly 13,000 have died in North Carolina since March 2020. So last year, a little over a year ago. But somebody who always keeps us on point. I call it a plug when it comes to this conversation. Of course, that's Dr. Tracia Black, Groundwater Solutions. She's also a sponsor of this show, and I enjoy talking to her every week because she keeps us updated and informed. So, Dr. Black, good afternoon to you.
Hi there. How are you, Tanya?
I'm doing great. So good to see you every week. Let's start with the question of the day. How does having the option to go unmasked, how does that make you feel right now? And we kind of talked about that a little week. I think
Mhm,
last week you kind of touched on it, and I believe if
mhm.
I understood correctly, you thought it was a little too soon. But now it's been
I
over a
do
week, and
think
correct
it's
me.
too soon.
You still think it's too soon.
Mhm.
So do you think
I
we're
still
making
think it's too soon.
Bill
I
out of
feel
your comfort?
anxious when
Okay.
yeah, I was at an event, a family event, a baby shower for a niece and
Uh-huh.
nephew on Saturday, and there were no masks. And
Ooh.
even for the expecting mom, who I know hasn't been vaccinated because pregnant women at this time, they were shying away from the vaccine for pregnant women. So I'm
Uh-huh.
thinking to myself, there's so much exposure at this event, and I'm sure that a majority of the folks there had not been vaccinated. So I'm always anxious when I go out and I don't see folks wearing masks. And even if you've been vaccinated, we know that there's still a risk for you to contract COVID. Just
Right.
like the flu vaccine will help you not catch the flu, or if you do catch it, that it's a shorter duration or less severe symptoms. That is the same thing with the COVID vaccine. You can still contract COVID, but ideally, with the protection of the vaccine, your symptoms will not reach a life-threatening point. I think that the challenge is most people now are of this belief that, the dangers of COVID is over. We're through the pandemic and we have made a
Right.
lot of progress, great progress, but we are not yet through it. And COVID
Yeah.
is still killing. People are still dying. We're making great strides, but we're not there yet. So I'm very nervous about folks in unmasked spaces.
Well, I just mentioned it's been a little over a week now, and now children as young as 12 can also get the vaccine, the Pfizer
Mhm.
vaccine. So, what are you seeing or hearing at your vaccination clinic? Are you getting more children to come through, or what's it been like?
We've had a handful of children. I will
Oh,
say that we were at, oh Lord, I can't think of the name, Northside Baptist Church, which is a large church in
yeah.
the north side of Charlotte. And
Right
it
off
was
Sugar
their
Creek, right?
enrollment. Mhm, right off Sugar Creek, and
Yeah.
it was their enrollment day event. There were 1,000 people there. We were on site with our full mobile unit and vaccination and testing, and we had 6 people come.
Wow.
And this is a school that serves K through 12, and even the students there, I mean, they're not ready. Maybe they weren't aware that the vaccinations were available for young people now, young as 12. But we did not see that traffic that we expected to see at that type of event.
So, Dr. Black, that's interesting that you said that because I happen to know, and I'm sure you've heard too, and that pretty much, the issue with evangelicals, a lot of them are not in support of the vaccine as well.
Mhm.
So, when you share that with me, I'm not surprised
You're
because
not
I was with,
surprised. Hmm.
no, and I was with someone yesterday who kind of, his minister follows along with
Hmm.
evangelicals, and he's told
Hmm.
his congregation, do not get the vaccine, point
Yeah,
blank. And it's a
yeah.
large congregation here in Charlotte, and it's an African American pastor. And he spoke up and said, "Do not
Hmm.
get it." And I was talking to the member, and he's like, "And I'm not getting it." So I'm not surprised to hear that about Northside. Nothing against them. I know some of those guys over there. I work with them. They're great
Hmm.
in the community, but I'm sure that's probably had something to do with it. So let's talk about Governor Cooper a little bit. He lifted the mask rules, and area
Hmm.
school districts are now considering changing their rules for graduation ceremonies. Now, ours, my son's already been set for outside. But what are some words of wisdom for families preparing for graduation? What would you say to them?
I would say definitely talk to the school districts where your children are attending. Express any concerns you have about indoor events. I do again recommend, like you said with your son, that events are held outdoors. I
Mm,
do not think the mask restrictions should be lifted for graduations because we know that most of the young people are not vaccinated yet.
right.
So there's still the chance for transmission and for our young people to be negatively impacted by that type of large event. I understand the celebration and we want
Yeah.
to see those beautiful smiles out there, but save those for the pictures where you're distant and you're not around everybody else. That would be my advice. I think use your hand sanitizer, all those different things that we've learned over the last year that keep us safe. Do not let up for your children. I so appreciated the mom who was on, Ashley, who was on a little while ago, who talked about the conversations that she's had with her children to talk about
Mm,
their concerns, to talk about real life situations that they might encounter where they have to make some decisions about their own safety. And so this is one for those parents and those young people who are graduating. You've got to make an intelligent decision about your own safety, not just what the rules of your ceremony are going to be.
and that's a great point. And Ashley was very personable, and that's just who she is. So I was glad that she shared that. Now you keep up with the COVID numbers and research really closely, and I'm just getting concerned,
Mhm,
especially too with our young people, but everybody. We're just so excited about the weather, so ready to get outside that we're just kind of
mhm,
saying, "Woohoo!" Just running, for lack of a better
mhm,
word, kind of buck wow every opportunity we get. Are there any trends that you're
mhm.
seeing? Look, you shaking your head, yes, because people are. It's like, I don't care. I'm done,
Yeah.
Enough of this already. So are you seeing
Mhm.
any trends that are happening?
Oh, I definitely see trends with what you're saying. I see most places I go now, I don't see folks wearing masks. Now, with regard to the
Mhm.
COVID numbers, we are not seeing reported spikes here in the United States in many areas. We're just not seeing it. I'm not convinced that they're not there. But
Okay.
when you look at, I was looking at the numbers for Canada yesterday. There are many spikes throughout Canada. So just I'm curious as to how we're not experiencing it, but a country directly to the north of us where they're shutting places down again in Canada.
Mhm.
And so I want to trust our numbers. I think the goal in America is to make us feel good, that and to say we're doing so great, we're ready, and we're just not there. And I think there's a lot of pressure because people do want to be outside. They want to be able to experience this gorgeous weather, this beautiful time of the year. We've had Mother's Day, we're having graduations, Father's Day is coming up, and so this is the time period in
Memorial
the
Day
year
is
where we
coming
want
up.
to, yeah, we want to celebrate, and masks are not very celebratory. And so I get that. Again, it's a
No.
psychological thing, and we cannot be fooled. We cannot be fooled, and we have to
Yeah.
protect ourselves. Mhm. Especially those
I
people who
think
have
if people would
chosen
just
not to
kind of
be vaccinated.
temper. Right, and
Hmm.
kinda temper their celebrations, kinda be a little bit more
Hmm.
cautious, but all we can do is make the suggestions and talk. I see,
Hmm.
Erica, she commented, "If others I see you have hopped on, I'd love to hear how you feel about the unmasking that has happened, if you're feeling a little bit more comfortable or not." Dr. Black, Groundwater Solutions, any final thoughts? Anything else you would like to share?
Yeah. So I'm thinking for folks who are hosting events, be responsible. Yes, be celebratory,
Mhm.
but for your guests, maybe send out a notice that masks are going to be available. We encourage you to wear. It's up to you whether you require that or not. But have masks available when people arrive, that they can just grab one. Have your hand sanitizers. Make your bathroom available so that they can wash their hands. Practice safety with your food. All of those things, the more that we need to be responsible. If I'm hosting an event, I'm going to take steps to make sure folks that are safe. And I think in every community, every event that we have discussions, even like conversations about COVID-19, about the vaccination, about what folks are doing to be safe. We're starting some
Oh,
roundtable discussions where we're going to be
oh, really?
talking to groups and challenging them to go out and talk to 10 other people. And it's not to say, oh, you must take the vaccine, but let's talk about it. Let's at least have some real live, authentic conversations about should you or shouldn't you, why you're not, what are you going to do to stay safe if you're not. And we need to have those around kitchen tables. And so at these events, it's the perfect time to do a little bit to educate, to be a part of the solution.
Oh, I like that, and you just gave me a couple ideas because I've got a graduation
Hmm.
coming up and some people over,
Hmm.
and of course it's outside, but I like what you're saying,
Hmm.
even, in the bathrooms, and maybe a little Lysol would go a long way too,
Hmm.
as
Hmm.
people just squirt or spray a little bit. So I like that. So the roundtables, you have to keep us informed about that. I know you're
Okay.
out and about today. I was supposed to call Terry back. Where are you guys today?
We are at, I believe we have 3 sites today: Kittyland
Oh, wow.
Daycare. I cannot get my calendar to come up because my computer is not cooperating with me, but we are at
Uh-huh.
Kittyland Daycare. We are in Salisbury, North Carolina, and we are at University Adult Care today.
Okay, good, good stuff.
In
Anything else,
in
Dr.
addition,
Black?
let me say this. So we are again testing every day, providing vaccines every day at our main office off of Sugar Creek, Reagan Drive. The number 704-596-0505. We are not, as we move forward, unless the community requests it, are not going to do a whole lot of community testing or vaccination events because the numbers are just really low. So we
Mm,
send teams of folks out and 3 people show up, 5 people, but we are
right.
available every day at our office. So I encourage you to call, get information, ask questions, and we'd be happy to help you.
Dr. Tracia Black, of course, with Groundwater Solutions. I appreciate you so much and thank you for that information. At least we
Thank
know,
you.
even for me, when I'm looking for information, I know exactly where to go.
Mhm.
So thank you for taking the time to
Thank
join us. Great stuff as always. She's always sharing great information. Of course, thank you again to Mecklenburg County Public Health, another resource for you to get information. They are looking to educate you. You've got any questions, they're more than happy to assist you. And we're at mecnc.gov is where you go to get the information. Salute and thank you for supporting canceling COVID. I did want to uplift this one thing I think is really important important that is that the North Carolina Housing Opportunities and Prevention of Evictions, they have opened a second application period. So if you are leasing and you need some additional funds to not get evicted, you have an opportunity to reach out. All you have to do is provide your rent and utility bills. They will provide rent and utility bill assistance for you, and pretty much help you from getting evicted, because right now it's not a good time. Although the moratorium is listed, this will prevent evictions and utility disconnection. So, we're not out of the woods yet, folks, but please take advice, take heed from the guys that we bring on here. It's for information purposes, to educate you on everything that we're dealing with as we continue to get through this thing called a global pandemic, which is real, as we all know. Great, great stuff. Thank you to Ashley Anderson, as well as Dr. Tracia Black, my forever producer extraordinaire, Amelia Henderson. I call him Millie Rock and some other things, always positive because I'm so appreciative. But we're going to wrap things up here today, folks. As always, life's challenges make you better, not bitter. We will, that is, return on Friday with more great information for you. So have a great week. Get out and enjoy this great weather and be safe. Thank you.